Okay, welcome back. And again, tonight I'm Dr. Michael Reiner, and I have Barbara Cutolo with me from Comfort Hospice. And we're talking about a pretty morbid subject of hospice medicine, which we were kind of talking about at the break, how we really weren't getting any call-ins on hospice because people really probably don't know what to ask.
Right.
And we're trying to at least explain that Comfort Hospice is an independent hospice program, as most of them are. And we are in Las Vegas. We do go up to Tonopah and northern part of Nye County. We go to Beatty, and we're trying to service people all over Nye County and Las Vegas to help them in what we think is a very difficult time, the end of life. And nobody really likes to think about the end of life.
No.
But we're all, we all do die. I mean, we may not even pay taxes, and I wish I never did. But we all will. We all will die at one point or another. And knowing that hospice is out there, knowing that it's a program that is good for people with a terminal illness, and what we do and how we do it. I mean, one of the things we talked about at break was, there are a lot of people say, I just don't know how you do that. I don't know how you are a hospice physician. And like you, I like breaking through the veil of cure, that ability to be able to say, listen, you're not going to get better from this illness, but I am going to make you more comfortable, and I am going to alleviate your fear and a lot of your anxiety about the end of life, and we're going to make you more comfortable. And that's what I do enjoy about hospice.
Mm-hmm. Me too, is making them comfortable, and they're very happy for that.
Yeah, and they're very happy in their home.
Yes.
And if you have any questions about hospice, and you're not sure about that, again, the number for Comfort Hospice will be on there. Someone will feel free to answer your questions if you don't want to bring that up on the thing. And yeah, nobody really likes to think about it, but if you're out there and you're alone and you have a chronic illness and you've made several trips to the hospital in the last couple of months, and your doctor isn't always available, and the ER doctor isn't really giving you what you need, hospice might be a program for you, to help get you back on the path of feeling better and getting you the services you need, or the possibility that maybe in the end is coming, and you shouldn't have to go through that alone, and you shouldn't have to go through that in pain.
Right.
And you worked in intensive care unit, didn't you?
Yes, I did.
Yeah. How'd you like that?
It was very intense. I mean, it was a lot of hard work. We saved lives. We lost some, but we really, we were more in the business of saving them and making sure, no matter what, more or less, that the people lived.
Right.
And sometimes it wasn't a nice life. Living on a ventilator the rest of your life isn't always the way to go, but this is so much nicer because the people get to stay in their homes. Mm-hmm. We try and explain and teach them so that they're not scared, mm-hmm. and we keep them comfortable. Mm-hmm.
And they have a number to call. They have a nurse to call. They have a chaplain if they're interested. They have a social worker.
24 hours a day.
24 hours a day.
Yeah.
And that's the beautiful thing about that hospice. You have access to all of those services, and it doesn't cost you a dime.
No.
It's totally free. It's a Medicare hospice benefit.
Right.
And so providing those services to terminally ill people it's really a godsend. It really, I mean, especially in a community where there really aren't a lot of services.
Right.
I mean, you look at Pahrump, and there's nothing here that's really. I mean, even the urgent care closes, and who wants to go to the ER at 11 o'clock at night and wait till 3 to be seen? It's just, that's the way healthcare is going, and it's not. I remember being a resident and an intern and having people come in that have had a heart attack or a stroke or things of that nature, and doing all of those intensive care things that we did at the time, push dobutamine and dopamine, all those drugs to maintain their blood pressure and do all those things, watching these, individuals, on a ventilator, and it was absolutely miserable.
Right.
And the end result was the end result.
Yeah.
And those are acute situations, and we still do that. And one of the things I do advocate for patients, and if we haven't already talked about it, is consider some advance directives tonight. If nothing else, consider the thought of planning out what if the end of life were to come? I mean, would you want to be on a ventilator? Would you want all of those things? And one of the things I did in my will, which I said that, I would be willing to have somebody do something intensive for a certain amount of time.
Right.
It doesn't have to be an all or none.
Black and white.
Yeah, it doesn't have to be a black and white. I mean, you could say that, I do want intensive care for 15 to 20 days. And after that time, it doesn't appear that I'm going to get better. They can pull the plug.
Right.
I mean, you can set it out however you want to. But if you don't speak your mind now,
you're going to get the full...
You may never get the chance to speak your mind later.
Yeah.
And as far as ambulances are concerned and the EMR service, if 911 is called and they do not see an advance directive or a DNR, they're going to do everything they can to save your life. That is what they have to do. Yeah. And so we do have a caller. Her name is Wendy, and she has a home health question. Wendy?
Hi. I was recently diagnosed with a tumor that has cancer, and I'm starting my, chemotherapy and radiation next week, and I'm alone. How do I get home health care? How do I get help, like at home? Because I don't know what I'm supposed to do when I get home after the treatment. I hear so many stories. People say so many things. It scares me.
She's looking for home health care treatment when she gets home from her chemotherapy, and she's alone, so she doesn't have anybody to take care of her.
Okay. So, Wendy, if you do get your chemotherapy and your cancer doctor, or the doctor that's usually giving you that treatment, should make a home health recommendation to the home health care agency that he may work with, so as to provide you that skilled need, especially if the chemotherapy is making you weak or you're having some untold effects from that particular treatment. He can make sure that he orders that. So that's a question that you need to put forth to your either your primary care provider, but not even that, certainly your cancer doctor who's administering the chemotherapy could and should make that recommendation for a home health, right?
Right, yeah.
And then they could provide teaching, they could provide if you have any wound care or strength issues, things of that nature. Home care is not really a come in and clean your house and do that, although I think they can do some light stuff, can't they?
Yeah. Yeah, they'll do, just like with us, they'll do light cleaning, clean a toilet or help make a bed or, sweep the floor a little bit.
Do they have CNAs in home care?
Yes, they do.
Okay. So for those that don't understand that, CNA is a certified nurse assistant, and they do a lot of the cleaning, bathing, and the other things that are daily activities of living that they need to do, correct?
Right. They can, with hospice, our CNAs can cook a little bit for you. They can help feed you if you need to be fed, change your bed, give you a bath. And I'm pretty sure that the nursing assistants with home health do the same thing.
Yeah.
That they can help with the light.
The caller also asked how she can get home health care and what does she need to do to get it.
She needs to speak to her primary care physician or to her cancer doctor, her oncologist. Let them know that she lives alone and that she needs somebody to help her. And that doctor can put in the referral for home health.
All right, because it was obvious she was, she was very, very alone.
Distraught.
She's very scared.
Yeah, it's a very scary time when you're alone and you're going to take a medication which could make you feel pretty puny and and I think that is truly a medical term,
Yeah.
feeling pretty bad. And so, but make sure that you do talk to your oncologist or your primary care doctor, whoever that is, and request home care. If you have one of the Medicare HMO programs like Humana or Senior Dimensions, they have a special program that they go through, and that referral needs to be made pretty quickly because it takes time to institute those things. It isn't a thing. The other thing is, if you know, call some of the home agencies in town. I think Integrity, some of them will actually do some of the work for you. I think they probably appreciate that and will call your doctor and set things up too, right?
Yeah.
I mean, you can self-referral, and you can self-referral to just about any of those programs. You can self-referral to hospice, and I do believe hospice, with regards to CNAs, we do have a little more flexibility than what home care agencies do, because at the end of life, we can do just about anything, and that's the other thing about hospice as far as comfort, pain medication, things of that nature. We can kind of go off the grid, off the scale, do things that are so-called, I wouldn't say, they're the edge of medicine, because we're trying to make people comfortable. I want to thank you for tuning in tonight. Again, I'm Dr. Michael Reiner with the Independent Medical Group, and this is Barbara Cutolo with Comfort Hospice. And if you have any questions, feel free to call the numbers that have been listed. Until then, I will see you next Monday night. Have a great night.